Welcome to Canadian Nurse Expert. Are you ready for a Next-Gen NCLEX RN challenge? A patient arrives in the ER with crushing chest pain, shortness of breath, and diaphoresis. Every second counts. Will you make the right clinical decisions before time runs out? Test your knowledge with these 10 must-know NCLEX questions on myocardial infarction. Stay until the end for a special bonus question that could save a life. A 60-year-old patient presents with chest pain. This isn't just any chest pain, it's severe and debilitating, causing the patient to clutch their chest in agony. The pain is intense and unrelenting, making it clear that this is a critical situation. The pain radiates to the jaw and left arm, classic signs that point towards a cardiac event. These symptoms are alarming and require immediate attention. What is your priority assessment? A. Blood pressure and oxygen saturation. B. ECG and cardiac biomarkers. C. Pain level and history of present illness. D. Listen to heart and lung sounds. As a healthcare professional, your first move is crucial. You need to quickly gather information and assess the patient's condition. We're talking about the heart, the engine of the body. The heart is a vital organ, and any issues with it can have serious consequences. The heart's health is paramount, and any delay can be detrimental. We need to act fast but also be thorough in our assessment. We don't want to jump into treatment without knowing exactly what we're dealing with. It's essential to differentiate between various potential causes of chest pain. Is it a simple case of heartburn, or are we dealing with a full-blown heart attack? The symptoms can sometimes be misleading, and it's our job to figure out the true cause. So, what's the priority? The answer is ECG and cardiac biomarkers. The priority is to obtain an ECG to assess for ST segment elevation or depression and draw troponin levels to confirm myocardial damage. Early recognition is key for timely intervention. Your ability to stay calm, think critically, and act swiftly can save lives. This is the essence of nursing in emergency situations. Which ECG finding is most characteristic of a ST elevation myocardial infarction? STEMI. Okay, nurses, now we're getting to the good stuff. The ECG, it's like the roadmap of the heart. Your options are A. Prolonged PR interval. B. ST segment elevation in 2 or more contiguous leads. C. Inverted T waves. D. Wide QRS complex. STEMI. It's a mouthful, right? But it's serious business. It means a major artery supplying blood to the heart is completely blocked. Think of it like a clogged pipe, and we need to act fast to clear it. So, what will the ECG tell us? Are we looking for peaked T waves, a widened QRS complex, or those telltale ST elevations? Remember, nurses? The ECG holds the key to unlocking this patient's diagnosis. Correct answer: ST segment elevation in 2 or more contiguous leads. STEMI is identified by persistent ST segment elevation, indicating complete coronary artery occlusion. This requires urgent intervention, such as PCI or thrombolytic therapy. A patient with a suspected MI or myocardial infarction is given aspirin upon arrival. This tiny pill is often the first line of defense in emergency rooms around the world. But what is its primary purpose? Why is this small, seemingly simple pill so crucial in such critical moments? Options are A. To dissolve the clot. B. To relieve chest pain. C. To prevent platelet aggregation. D. To decrease heart rate. We all know aspirin, right? It's a household name found in almost every medicine cabinet. Headache, fever, you name it. It's been our go-to remedy for common ailments for over a century. But in the world of heart attacks, it's a lifesaver. When it comes to cardiovascular emergencies, aspirin's role is nothing short of miraculous. Correct answer is C. To prevent platelet aggregation. See, when a heart attack strikes, those platelets can get a little too sticky, clumping together and forming a clot. This clot can obstruct the flow of blood, leading to severe consequences. And that clot, well, it's like a roadblock in the artery, blocking blood flow to the heart. This blockage can cause significant damage to the heart muscle, leading to a full-blown heart attack. Aspirin swoops in and thins the blood, making it harder for those platelets to stick together. It essentially acts as a blood thinner, reducing the risk of clot formation. It's like giving those platelets a good talking to, telling them to calm down and stop causing trouble. By doing so, aspirin helps restore normal blood flow, minimizing the damage to the heart. So, the next time you see that little white pill, remember its mighty power. It's not just for headaches, it's a true hero in the fight against heart attacks. A. Beta blockers. B. Morphine. C. Nitroglycerin. D. Aspirin. Inferior wall MI. It's a specific type of heart attack affecting the bottom part of the heart. This area is particularly sensitive to changes in blood pressure, making treatment choices even more critical. And for these patients, certain medications can do more harm than good. The wrong drug can exacerbate the condition, leading to severe complications or even death. We need to think about blood pressure here. Maintaining stable blood pressure is crucial for patients with inferior wall MI. Any significant drop can be life-threatening. Some medications can cause it to plummet, which is the last thing we want in an already compromised heart. This is why the choice of medication is so important. So, are we avoiding nitroglycerin, morphine, or maybe beta blockers? Each of these medications has its own set of risks and benefits. The key is to know which one poses the greatest risk in this specific scenario. Correct answer is nitroglycerin. Inferior wall MIs often involve the right coronary artery, RCA, affecting preload-dependent right ventricular function. Nitroglycerin can cause severe hypertension by reducing preload. Lab test 101. Finding the smoking gun. Which lab test is the most specific for diagnosing an acute myocardial infarction? The options are A. CK-MB D-dimer, C. troponin 1 and TD. BNP lab tests, they're like the detective work of medicine. They give us clues, helping us piece together the puzzle of what's going on inside the body. And when it comes to heart attacks, we need the most reliable evidence. We're looking for a specific marker, something that screams heart attack. Something that tells us without a doubt that heart muscle is being damaged. So, is it the white blood cell count, the creatinine level, or those telltale cardiac enzymes? The correct answer is troponin 1 and T-troponin is the most specific and sensitive biomarker for myocardial infarction. It remains elevated for 7-10 days after myocardial injury. Chapter 6 STEMI Strike. Time for action. What is the first-line treatment for a confirmed STEMI? Here are the options. A. Thrombolytics. B. Percutaneous coronary intervention, PCI. C. Coronary artery bypass grafting, CABG. D. Nitroglycerin infusion. We've got a confirmed STEMI, nurses, which means it's time to act fast. Remember that blocked artery we talked about? Well, now's the time to open it up, to restore blood flow to the heart muscle. But how do we do it? Do we reach for the medications, prepare for immediate surgery, or is it all about that angioplasty? This is a critical decision point, nurses, and the right choice can mean the difference between life and death. Correct answer: percutaneous coronary intervention, PCI. Up next, metoprolol, calming the storm after the attack. A patient recovering from an MI is prescribed metoprolol. What is the primary benefit of this medication? A. Lowers cholesterol. B. Reduces myocardial oxygen demand and prevents arrhythmias. C. Improves cardiac output. D. Increases myocardial contractility. Our patient is recovering, which is fantastic news, but the journey isn't over yet. We need to make sure their heart is protected and supported as it heals. Think of it like applying a soothing balm after a particularly satisfying extraction. Metoprolol, it's one of those medications that helps the heart relax and chill out. It's like giving the heart a little vacation after a stressful event. So how does it work its magic? Does it lower blood pressure, reduce heart rate, or maybe both? Correct answer: reduces myocardial oxygen demand and prevents arrhythmias. Beta blockers reduce heart rate and contractility, lowering myocardial oxygen demand and decreasing the risk of ventricular arrhythmias. A patient reports new onset dyspnea and fatigue after an MI. It seems our patient is experiencing some new symptoms. Dyspnea and fatigue. That's shortness of breath and feeling tired all the time. After a heart attack, the heart can be weakened, and it might not be pumping as efficiently as it should. This can lead to fluid buildup in the lungs, making it hard to breathe. So, what are we dealing with here? Options are A. Heart failure. B. Pulmonary embolism. C. Stroke. D. Hypovolemic shock. Is it heart failure, pneumonia, or maybe something else entirely? Correct answer: heart failure. Heart failure may develop post-MI due to impaired left ventricular function, leading to pulmonary congestion, fatigue, and dyspnea. Which diet is most appropriate for a post-MI patient? Options are A. High-protein, low-carb diet. B. Low-sodium, heart-healthy diet. C. High-fat ketogenic diet. D. No restrictions needed. After a heart attack, it's more important than ever to nourish the body with the right nutrients. We want to avoid foods that will make the heart work harder or clog those arteries again. No more greasy burgers and fries. Instead, we need a diet that's heart-healthy and delicious. So what's on the menu? The right option is low-sodium, heart-healthy diet. We're aiming for a diet that's low in saturated fat, cholesterol, and sodium. A low-sodium, heart-healthy diet helps control hypertension, cholesterol, and fluid retention, promoting cardiac recovery. Moving on. Which of the following is a life-threatening post-MI complication? Options are A. Ventricular fibrillation. B. Atrial fibrillation. C. Pericarditis. D. Bradycardia. Even though our patient is recovering, we can't let our guard down. Complications can happen, and some of them can be life-threatening. Chest pain, shortness of breath, irregular heartbeat, these are all red flags that something might be wrong. So, what's the most dangerous complication we need to be aware of? Is it cardiac tamponade, ventricular fibrillation, or maybe another silent killer? This is where your knowledge and quick thinking can truly save a life. The correct answer is ventricular fibrillation. Ventricular fibrillation is a deadly arrhythmia that can cause sudden cardiac arrest post-MI. Immediate defibrillation is required. How many did you get right? Share your score below. Like and subscribe to Canadian Nurse Expert for more Next-Gen NCLEX prep.